So we all know it's important to think about bone health, but way too often this gets pushed to the side. And that's really problematic because did you know that more women will suffer from an osteoporotic fracture than they will from heart attacks, cancers, and strokes combined? Yeah, that's right. So knowing about bone health is particularly important. In this video, I'm going to give you 3 tips on bone health to keep you healthy into your 60s, 70s, and 80s. For those of you who don't know me, hi, I am Dr. Heather Hirsch. I am the Clinical Program Director of the Menopause and Midlife Clinic at the Brigham and Women's Hospital in Boston, Massachusetts, where I see patients on a consultative basis for all things perimenopause, menopause, bone health, sexual health, breast health, genital urinary syndrome of menopause, and more. I'd love to see you in my clinic. It's the best place to get real direct advice, and I will put the link to my clinic in the description bar below. I also am faculty at Harvard Medical School, and I am so delighted that I get to teach the upcoming medical students and residents, and sometimes the fellows who are doing postgraduate training on all things midlife and menopause. I also do a ton of teaching to physicians all across the country, and I am so excited if you are a healthcare provider and you are here on this channel. I also have an amazing course, The Complete Guide to Menopause, and within that there is a mini section on bone health that I'm going to link both underneath that in the description bar below, so definitely check it out if you want to learn more. For the very best menopause advice, please be sure to subscribe to the channel. New videos come out mostly every Friday, and I don't want you to miss one. Also, you can follow me over on Instagram. I'm at hormone.health.doc, where I let you guys weigh in on the topics that you want to hear about. Now, this one on bone health has been highly requested and long overdue. All right, so when I talk about the 3 tips, without further ado, here they are. The first one is I want you to get a bone density. Second, I want you to know your risk factors for low bone mass, which is osteopenia and osteoporosis. And 3, I want you to know that if you are symptomatic heading into menopause, that estrogen replacement in the form of hormone therapy is very protective for your bones. Before I get into each of those, be sure to comment below if you have been putting off bone health and you are ready to dive right in, and if you have any particular questions about bone health you want me to address in another video. All right, without further ado, let's get into number 1, get a bone density. Now, I know that it's not a drive-through, so you can't just walk up to the imaging center and say, hi, I'm here, I'd like to get a bone density. You certainly need a provider or clinician to order a bone density for you. But I want to tell you a little bit about why it's important to get a bone density and why I particularly don't think it's something that you should put off for too long. Now, the U.S. Preventative Task Force Services comes out with their recommendations on when to get all sorts of screening tests, whether it's a mammogram, a colonoscopy, or a bone density. And just like many things in medicine, these do change over time. More research will come out, more experts will weigh in, and guidelines will change. So the way it stands right now is that our clinicians recommend a bone density at age 65. Wow, age 65 if you have no other known risk factors. Now, in point number 2, I'm going to get into risk factors because most women do have at least one risk factor which will allow you to get a bone density earlier. So I'm going to come up to that in a second. But personally, I really do think that age 65 is far too long to wait to get a baseline bone density. Now, when do I typically recommend them? About 1 to 2, maybe 3 years post-menopausal. The reason is we lose the most amount of bone when we go through menopause. Estrogen that we make from our ovaries is really, really good for bone health. And the way that it actually works is that we have 2 kinds of cells. We have cells that break down bone and cells that build bone, and they're constantly working. Kind of a good metaphor for this is like a bank account. Hopefully you have a bank account and you're constantly putting money in, but you're also taking money out. And you hope at the end of the day that there's still money in the bank. Well, bones are really similar. So there's the cells that are constantly breaking down the bone and the cells that are building the bone, and you want to make sure that there is more bone that's being built than there is more bone that is being broken down. So estrogen actually stops the cells that break down estrogen. And so when we lose estrogen at menopause, that benefit that estrogen was had on our bones is kind of no longer there. So that ratio of breaking bone down to building bone up can get thrown off. It's a really big reason most women have bone loss. Now, really briefly, it's probably important to go over just some of these definitions here in this section as we're talking about gaining a bone density. The first definition is osteopenia. Osteopenia is the precursor to osteoporosis. Almost like pre-diabetes is the precursor to diabetes, or pre-hypertension is the precursor to hypertension. Now, many people are told they have osteopenia and that their bones are normal, or there's nothing they need to do, or there's nothing they need to worry about. And if you're really interested in separating osteopenia and osteoporosis, you definitely should check out my course. So again, in the Complete Guide to Menopause, I have modules, and I've broken those modules down if you just wanted to get the bone health course. But I talk about the difference between osteopenia and the fact that you can do plenty of things to treat osteopenia, because it's not totally benign. It is the precursor to osteoporosis. Now, it's based on your T-score, which is what's reported when you get your bone density. So I really do think that you should get a bone density within a few years after menopause. Now, a lot of times I don't have trouble getting insurance to pay for this because I can often find a secondary reason, even estrogen deficiency. When I go to click that button on my computer to put that through for your insurance, that is often a reason. You can always check with your insurance and ask your doctors if you can get a bone density, because I really think waiting till 65 is way too long. I see a lot of patients for menopause consults who are considering hormone therapy, and I will come back to this in point number 3 because it's an excellent time to get a bone density. Moving on to point number 2, what are your risk factors for low bone mass? There's actually a lot. There's so many that I really don't script my videos. I'm probably gonna forget some, but I wanna go over the ones that are the most common. Certainly any kind of early menopause, so premature ovarian insufficiency or premature menopause, which is menopause before age 40, even early menopause, which is menopause before age 45, or any type of surgical menopause before age 45, or any other kind of menopause that was induced, such as because of pelvic radiation or chemotherapy. All of those are indications for you to get a bone density much earlier. Also included in that risk is if you've had prolonged use of steroids. Now, a lot of people will use topical steroids on their skin or steroids that they inhale for asthma, and these are not as, harsh as oral steroids that you might have to use. And when I say prolonged period of time, I mean for greater than 3 months. So certain autoimmune conditions, for example, like Crohn's disease or ulcerative colitis, come to mind as something where patients may have had prolonged use of steroids, also something like MS or something like that. Now, if you've had many bursts for something like COPD or asthma flares, that's another thing you could definitely consider for a reason to get a bone density earlier. Any type of family history of osteoporosis is also a secondary risk factor, and that can get you a bone density earlier. Any type of malabsorption issue, again, whether it's ulcerative colitis, if it's Crohn's disease, if there's, again, some other type of malabsorption, even something like a bariatric surgery, you might have malabsorption after a bariatric surgery, that could be an indication. Any type of thyroid condition, hypothyroidism, both of those are indications for you to get bone densities earlier. Any type of history of eating disorder or prolonged loss of estrogen are reasons to get bone densities earlier. And also, if you have been using Depo-Provera, which is the contraception injection, into your 40s, that's another indication for you to get a bone density. There's probably more. I know that I should know them all off the top of my head, but there's so many reasons that you could get a bone density before age 65, which is where you have absolutely no known risk factors, no family history, etc. Oh, I forgot a couple. Smoking history, and also being slender or having a BMI maybe less than 20 could also be risk factors to get a bone density. See, I knew there was going to be more. And then moving on to point number 3, if you are symptomatic in the menopause transition and you are considering hormone therapy, estrogen is a proven benefit for osteopenia. So like I said in point number 1, when I'm consulting with patients and they're considering hormone therapy and they haven't had a bone density yet and they're, 1, 2, 3 years postmenopausal, I almost always get a bone density. And for a majority of these women, we do find some early bone loss, aka osteopenia. And that's just another reason they feel as though that estrogen that they're taking is providing many benefits. Again, not only the benefits that you can feel, such as reducing hot flashes, night sweats, mood changes, vaginal changes, etc., but it's also helping things that you cannot feel, like your heart health, your brain health, and your bone health. So estrogen is a really excellent treatment option for osteopenia. And did you know you can use estrogen for osteopenia without any other symptoms? It is actually approved to treat osteopenia. That's really cool to know, especially again if you are symptomatic or if there's other things that you don't want to do for osteopenia, such as a bisphosphonate or some other treatment options that I won't get into in this video. Now, one caveat here, if you have osteoporosis, where you have a T-score less than -2.5 and it's no longer the precursor osteopenia, it's osteoporosis, that is when estrogen alone is not excellent treatment in and of itself. So while that's a greater conversation, typically I will say you also need a bone agent once you have osteoporosis. And there are many different types and kinds of bone agents, all of which I talk about in my course. So if you're very, very interested, we could always do another quick video on those. So now you know a little bit more about bone health and really how important it is. Let me know in the comments if this was helpful or if you'd like to hear more videos on bone health. Don't forget, I have a course, The Complete Guide to Menopause, which covers every single thing, including the module on bones. But if you just want to take the bone health, if you just landed on my channel because of the bone title and what we're talking about today, I do have a mini course on that as well, which is just that module, and you can sign up for that. I will put the link in the description bar below and you can check it out there. Also, I have many other resources in the link below. I do have an Amazon store. You don't have to get them from there, but that is where I do put my favorite vitamins, supplements, books, and so many other things that I really, really like and recommend for my patients whom I see in clinic. Also, don't forget, if you're looking for a menopause doctor, one of the most common questions I get, you can check out menopause.org and look for a NAMS or North American Menopause Society certified physician near you who should have just as a knowledge bank on bones as I do on all things menopause and hormone therapy. I really appreciate you guys tuning in every Friday to check out my videos. This channel is growing so fast. It is so exciting to see. It just makes me want to make more and more videos for you guys. So please let me know what you want to hear next. Please feel free to share these videos on your social media if you find them really helpful. Send it to a friend, sister, colleague, a parent who you think needs to hear it. Thank you for all of your support. I am so happy that you have landed here. Please give this video a thumbs up and please hit that subscribe button. I will see you guys next Friday for a brand new video. Thank you so much. Bye.